Good morning, and welcome to the SARS-CoV-2 background training for schools within the Children's Study Home. The information that we are about to review is just a little bit of publicly available background information related to the SARS-CoV-2 virus. It was compiled through sources such as the Centers for Disease Control and Prevention, the National Institutes of Health, the World Health Organization, and the Massachusetts Department of Public Health. Please note that the data and the research on this virus are ever evolving. This presentation was created on Monday, June 15th. So the information relayed, it was current as of Monday, June 15th, but depending on the date that you are listening to it, some of the information might have changed. So some basic terminology related to viruses and infectious disease. So generically, a pathogen is any microscopic material that has the potential to cause disease. Viruses and bacteria are both common pathogens that we often have conversations about in relationship to infectious disease and infection control. Coronavirus is a generic term. It is a family of virus that's most commonly associated with symptoms of the common cold. What we are dealing with SARS-CoV-2, the novel coronavirus, a new coronavirus, however, can cause more severe infections and more severe disease. It is called, its official name is SARS-CoV-2. There was a SARS-CoV-1, which we'll talk about a little bit, back in 2004. And the name corona refers to the appearance of the virus under a microscope. Researchers observe a crown morphology or shape when they look at it. So the family of viruses is called a coronavirus. Specifically, SARS-CoV-2, or Severe Acute Respiratory Syndrome Coronavirus 2, the official name of the viral pathogen that has been known to cause COVID-19. It is the second coronavirus to cause a severe acute respiratory syndrome. You might remember the SARS epidemic of 2004 that was caused by SARS-CoV-1. At the time, there was significant public health response with aggressive testing, quarantine, and contact tracing. So SARS-CoV-1 did have a small global spread, but nowhere near the impact that SARS-CoV-2 has had. There are also differences in the incubation period of the two viruses, which we will talk about in a little bit. Disease is a syndrome or dysfunction of body systems that can be caused by the presence of an infectious pathogen. Not all infectious pathogens can result in disease. Sometimes the immune system is able to fight off the infectious pathogen and disease does not occur. Sometimes the infectious pathogen exists within the body in sort of a carrier state, and we'll talk about that in a little bit. That is really important with SARS-CoV-2 because the research is showing that not everyone who has become infectious shows symptoms of the disease. COVID-19, or coronavirus disease 2019, is the syndrome of symptoms that has been shown to be connected to an infection by SARS-CoV-2. The most common symptoms are fever, shortness of breath, and persistent cough. There have been other associated symptoms, fatigue, muscle pain, abdominal pain or discomfort, loss of taste, loss of smell. However, those are not consistently reported across all populations and across all of those who become infected. So the primary symptoms that are used in screening are fever, shortness of breath, and persistent cough. Infection simply is a term that means that a person has been exposed to a pathogen, the pathogen has entered their system, and it has begun to do whatever it does within their system. Sometimes the infection will lead to disease, will lead to symptoms, and sometimes folks can be carriers of the infection. They can have the infection in their body and never exhibit symptoms. Virulence is a broad term that refers to the virus's ability to cause disease. The more virulent a pathogen is, the more likely is that it will infect and cause disease. Incubation period refers to the time between the infection and the development of symptoms of the disease. The longer that incubation period is, the longer it takes for symptoms to develop. Back when the pandemic began, a lot of the guidance was related to an incubation period for as long as 14 days. When folks were thought to have been exposed to the virus, there was a 14-day quarantine period. As we've learned more about the virus and the research has updated, we're beginning to notice that the majority of folks are developing symptoms within 4 to 5 days of infection. So there is updated guidance that says when folks are exposed, they can return to work if they remain asymptomatic after 4 to 5 days, as long as they are using PPE protections. So those symptoms are showing up according to that timetable. It's also important for folks to remember that you can be infectious and actively shedding the virus for up to 48 hours prior to the development of symptoms. That fact is super important related to contact tracing. Should we have a positive infection within our agency, we will have to do internal contact tracing. We will have to go back to 48 hours prior to the development of symptoms to really ensure that we are identifying all of the contacts. The R0 or the R0 is another term that is being talked about a lot. It refers to the reproductive number or the reproductive rate of an infection. It is a statistical calculation, and it refers to the number of people that one infected person can pass along that infection to. The higher the number, the more additional people that the one infected person can infect. It is not a fixed number. It's not a direct connection to the virus. It's a dependent variable based on community mitigation factors in human behavior. Back at the beginning of March, the R0 in Massachusetts for the virus was calculated to be 2.7. What that means is that for every infected individual, they could potentially infect slightly under 3 other people. And then those 3 other people could also potentially infect slightly under 3 other people. The goal through all of the social distancing, mandated mask requirements has been to push that number below 1. When creating this presentation, we were unable to locate real-time data to reflect the current R0 in Massachusetts in our community. But given the improvements in other health metrics related to the spread of the infection, we can infer that that number is down. However, I do not have exact data on that number. Here's a little bit of a graphic representation for the R0. So if we have one infected individual, and that infected individual does nothing to social distance, wear a mask, stay home, contain their symptoms, then they can infect up to 2.7. It's easier graphically just to represent 3 other people. If those 3 other people do not engage in any behavior to mitigate spread, they can infect each 3 other people. If those people do nothing, then the infection begins to spread, and spread rapidly, as we saw early on in the state and across the country. If we go and look at what happens if the infected individual engages in the behaviors, staying home when sick, wearing a mask when around others, staying socially distant, then we can see that those measures, those community mitigation measures, do reduce the spread of the infection. It is not 100%. The virus continues to circulate within our community, but if we can, through robust contact tracing, isolate, quarantine, and have robust intervention with other folks, then what we start to see is a much slower spread of the virus throughout the community. Viral shedding refers to small pieces of the virus, which is made up of either DNA or RNA, that leave the host. So once you become infectious, your body is going to shed the virus back into the environment. And it can shed it in various ways. So viruses that are said to spread through contact, think chickenpox, think pink eye or conjunctivitis. When those viruses shed, they live on surfaces. And they can easily be transmitted via contact, via surfaces, to another person. If you were to work in a healthcare facility, you would see contact precautions that's related to the use of gloves and gowns to try to prevent that spread through contact. It is possible for the SARS-CoV-2 virus to live on surfaces, particularly non-porous surfaces, high-touch surfaces, which is why there's significant amounts of guidance related to the cleaning and disinfection of those surfaces. It is also possible for that virus to be, through contact, picked up by another person and enter their body, through a behavior such as rubbing your eyes. It is not the primary risk of spreading of the virus. However, it is a concern, which is why the CDC has made the recommendations related to cleaning and disinfection that we engage in, that we ask employees to engage in. Droplet spread is a term that refers to pathogens that spread primarily through the inhalation of droplets, or small amounts of water vapor that contain the virus. And when they expel those water droplets into the environment through coughing or sneezing, they can be inhaled by other individuals, and therefore the virus ends up in their body. Typically, the droplets can travel about 3 to 6 feet. However, depending on the forcefulness of the cough, the forcefulness of the sneeze, the environmental considerations of the room, it is possible to get droplet spread as far as 10 to 12 feet from the individual. SARS-CoV-2 is said to primarily spread through droplets. That is the reasoning behind current social distancing recommendations, staying apart from each other, making it harder for the virus to jump those distances, as well as mask wearing guidance, and staying at home when sick, when coughing, when sneezing, things like that. Airborne spread refers to pathogens that spread through a process called aerosolization. This is where the virus can be expelled in small amounts through talking, laughing, and singing. Aerosolized droplets shed most of the moisture and become lighter, and are therefore able to travel more considerable distances as well as linger in the air for some time. Current research suggests that there is a certain level of aerosolization occurring with SARS-CoV-2, and we're drawing on the fact that folks who are asymptomatic, folks who have either not developed symptoms or have developed very mild symptoms, appear to be able to spread the virus. So if they are not coughing or sneezing, then there must be a certain amount of the virus that is being aerosolized through talking, laughing, singing, etc. This is the science behind the current requirements of masks for all individuals, regardless of the presence of symptoms. This is why when you are at work, you are required to wear a mask when you are not able to socially distance from others. The belief is that my mask will protect you and your mask will protect me. And that if the community continues to protect each other, then we can have significant reduced risk of spread of virus through aerosolization. So if we put all of this together, COVID-19 is a respiratory syndrome, respiratory disease caused by the SARS-CoV-2 virus, which is a coronavirus, a novel coronavirus. The virus is believed to spread primarily through respiratory droplets that are inhaled and lodge in the respiratory system. Transmission can also theoretically occur through contact, although this is not the primary route of spread. The primary symptoms of the disease are fever, persistent cough, and shortness of breath. Some other symptoms that have shown connection to the disease are fatigue, muscle pain or weakness, abdominal pain and discomfort, and loss of taste or smell. However, symptom screening is primarily based on fever, persistent cough, and shortness of breath. Those are the most common associated symptoms of the disease across all populations. Anyone who has those three symptoms is encouraged to stay home and to contact their medical professional. In addition to that screening of symptoms, social distancing and the wearing of face masks is required. Cloth face coverings will do. We will have specialized types of PPE, including disposable surgical style masks and disposable KN95 masks for high risk behaviors. But cloth face coverings are the current recommendation for general use. Social distancing of at least 6 feet is also significantly makes it significantly more difficult for the virus to jump from person to person. So even though you are wearing the cloth face covering, we encourage you to also maintain as much distance as possible. The wearing of masks will help reduce the risk of droplet and aerosol traveling by trapping that water vapor, those aerosols on your face. My mask protects you, your mask protects me, and reducing our group size allows for more effective social distancing. The virus spreads most easily indoors in crowded spaces. So as we look at our programming, we are adjusting to reduce that risk. Effective hand washing can also help mitigate the spread of virus from any contact methods, including contact with your mask. Remember, the mask is designed to trap those aerosols, trap those droplets close to your body, which means that your mask does become contaminated over time. So we need to make sure that we're using effective hand washing when we're putting on and taking off the mask, and that we are regularly cleaning and disinfecting our masks. With these community mitigation strategies, we cannot ever guarantee 100% safety from SARS-CoV-2. The virus is still actively circulating in our community. However, there is a lot of data from the medical and community settings that have been operating in an emergency mode. Think emergency daycare centers, grocery stores, essential businesses, things like that, that these measures, social distancing, mask wearing, do work. The PPE does work. And that when using it all together, that we can significantly reduce the risk of transmission of the virus, and therefore creating a safer work environment. So thank you very much for participating in the SARS-CoV-2 background information webinar. If you have any specific questions or require more information, please do not hesitate to have contact with your supervisor. Thank you and have a nice day.